All right, I've got 1 o'clock, so I'm going to get things started. We do have a hard stop today at 1:30, so we ask y'all to keep that in mind. But good afternoon. I am Casey White. I'm a public information officer with the South Carolina Department of Public Health. Thank you for joining our weekly measles media briefing. We'll be joined by Dr. Linda Bell, state epidemiologist, who will provide an update and answer questions about the measles outbreak in the upstate. If Without further ado, I'll turn things over to Dr. Bell.
Thank you, Casey, and good afternoon, everyone. On Tuesday, the South Carolina Department of Public Health reported 29 new cases of measles in the state since Friday. That brings the total number of cases in South Carolina related to the upstate outbreak to 876. There are currently 354 people in quarantine and 22 in isolation. The latest end of quarantine for these is February the 24th. And this includes 147 people in quarantine across 10 K through 12 schools. DPH has also confirmed a case of measles in a Sumter County resident. At this point in the investigation, it is not yet clear whether this new case is linked to the upstate outbreak centered around Spartanburg County, or if the case may have been exposed somewhere else where measles cases are occurring in other locations. Most cases, that is 841 of them, are still located in Spartanburg County, with additional cases in the nearby Greenville, Anderson, and Cherokee counties. And while complications are not reportable to DPH, we have learned of 19 hospitalizations for complications of the disease since the beginning of the outbreak in October. Some of these complications include measles encephalitis, or inflammation of the brain in children, and pneumonia. And additionally, several pregnant women were exposed to required administration of immune globulin to protect against the high risk of complications from measles to pregnant women and their newborns that they could infect. These are complications we hope to prevent, and increasing vaccination coverage protects those who cannot be vaccinated, like young infants, pregnant women, and those with weakened immune systems. Of our 876 outbreak-related cases whose vaccination status is known, about 95% of them are unvaccinated. I am reporting that we're encouraged by a strong increase in MMR vaccination last month, with monthly totals in January showing some of the highest that we've seen in years. Over 7,000 more doses of measles vaccine were given statewide in January of 2026 as compared to January of 2025. That's a 72% increase. In Spartanburg County, over 1,000 more doses were given in January 2026 compared to January 2025. That's a 162% increase. And so far, this is the best month for measles vaccination during this outbreak. No vaccine offers 100% protection against infection, but the MMR vaccine is one of the most effective vaccines in preventing infection. It has been shown to provide lifelong protection against measles for about 97% of those who complete the recommended 2-dose series. And it is this vaccine that is responsible for us being able to eliminate ongoing transmission in the United States. The MMR vaccine is widely available at many primary care providers' offices, at pharmacies, at DPH health departments, and many children can receive vaccines at no cost to the family through the VFC or the Vaccines for Children program or through their health insurance. With the identification of a single case of measles in the PD area with no source of exposure identified so far, DPH strongly encourages anyone who is not protected, regardless of where they live, to take advantage of the opportunity to get protected against unexpected exposures and illnesses. Achieving high vaccination coverage prevents ongoing spread and protects our communities. And with that, Casey, I will turn it over to you to help with questions. Thank you.
Thank you, Dr. Bell. And as most of you know, if you don't mind raising your virtual hand, we'll call on you in the order in which you raise your hand. We do ask that you ask one question at a time to give folks chances to answer their questions. That's especially important today as we have to stop, as I said earlier, at 1:30. And I will take the first question from Kiki.
Hi, Dr. Bell. I was just wondering if you could speak to the effectiveness of the titer test and if that is something you'll recommend.
So the titer test is indicated if we're trying to establish immunity. And it detects the presence of antibodies that protect against the measles virus. If somebody does not have a documented history of disease or of a vaccination, this is not a test that's widely recommended, but it can be used by people if they need documentation of immunity for reentry or something like that. It's a very reliable test. And it's not widely recommended that everybody do that because if you get the test for immunity and you're negative, you have to get the vaccine anyway if protection is what you're seeking. And so actually what we recommend is to just go ahead and get vaccinated.
Thank you, Dr. Bell. Tom?
Tom Corwin, Post and Courier. You may have stated this already, so I guess I'm asking you to restate it. The increase in vaccinations, how are you viewing that? And do you have any thoughts about why that is increasing?
So yes, we are encouraged with the uptake in vaccinations in this past month in January, the strongest uptake that we've seen since the beginning of this outbreak. And I'm hoping that what we can attribute that to is a wider recognition of the threat of this disease circulating in our communities and the desire for people to be protected against the complications.
Okay, thank you.
And Mackenzie?
Hi, Mackenzie Musket, Spectrum News. I know that the last report showed 29 new cases, and that seems a little lower than previous reports in the last few weeks. I'm wondering if you think it is a little bit lower because we have had back-to-back winter storms recently. So are people just not going to get tested, or do you think the winter storms have kept people inside, kind of stopped the spread a little bit?
Well, it would be a bit early for us to detect a decline in spread attributed to this last weekend. Now, perhaps we would see a drop from the previous weekend with an incubation period of the shortest time frame being about 7 days. It is actually our hope that this may be an indication of a downward turn in actual cases that are occurring and not some sort of underreporting or people not being tested. We have other indicators about disease circulation in the community, like healthcare visits and hospitalizations. And without those numbers increasing, it does indicate that we are able to test the majority of people who have measles.
Thank you.
All right, and Maria? And Maria, you may be muted if you're talking. And I'm not hearing anything.
Hi, can you hear me?
Oh, yes,
Hi.
now we can.
Sorry about that. This is Maria Godoy with National Public Radio. Dr. Bell, so just to be clear, do you attribute the increased vaccination that you saw in January to like increased outreach efforts or just more awareness among the public about the spread of the disease? And I lost your sound for the previous answer. Would you mind just reiterating whether you think is it too soon to say for sure that it's slowing down?
Yes. We do believe that our outreach efforts are what is increasing awareness in the community. So those two things are related. And so as we continue to report in weeks past a significant surge in cases and cautioning people about the increased risk of exposure and the number of public settings where we had identified cases that had been, the reason that we're doing that is to make people aware, to give them information about the opportunity for protection. And so we do hope that those two things are related. With the lower number of cases that have been reported subsequent to the 2 weekends that we've had of winter weather, it is a bit early to tell whether or not people staying inside during those winter storms is significantly affected this, particularly for this last weekend. We may begin to see some effects of that from the winter weather that we had in the previous weekend. And it is a bit early to tell whether this is truly a downward turn in our cases or if those people who are currently in quarantine may incubate out and we see more cases around those. So it's a bit early to tell where we are in this trajectory.
Thank you.
Thank you.
Erica?
Hey, thank you so much. It's Erica from NBC News. I was wondering if you could speak just a little bit more about the encephalitis you mentioned. Would you characterize these cases as recovered, recovering, or are there long-term complications? Thank you.
Well, we don't comment on the outcomes of individuals, but we do know that inflammation of the brain or encephalitis is a known complication of measles. And anytime you have inflammation of the brain, there can be long-term consequences, things like developmental delay and impacts on the neurologic system that can be irreversible. So what we know about encephalitis in general is what we warn people against, regardless of the outcome of each individual case. We want to prevent this potential complication in anyone.
Thank you. Tanner?
Hello, Tanner Martin with WIS News 10. I was hoping you could talk a little bit about prevention along with getting the vaccine. How would someone catch measles at the store, or how do you prevent that? Masks, anything else like that?
Well, the measles virus is spread by respiratory droplets from person to person. Not only people who are in close contact with a person who is with direct contact with somebody who's actually actively infected, but we know that the measles virus can remain suspended in air spaces for as long as 2 hours after a person who's infected is left that area. So those are the ways that people can be exposed, and that this obviously can happen unknowingly. Whether or not masks can protect against the small measles virus is not something that we're necessarily recommending, but we do know that masks prevent and reduce the risk of the transmission of all respiratory viruses, and measles is transmitted by the respiratory route.
Thanks, Dr. Bell. Joseph?
Hi, Joseph with ABC News. Thank you, Dr. Bell. I'm wondering what needs to happen for this outbreak to stop, and when do you think the soonest that could be?
Well, what we understand about the high contagiousness of the measles virus is that achieving a vaccination coverage in a population of at least 95% is what's needed to maintain interruption of transmission. And so that is one of our goals, is to get very high vaccination coverage to at least 95% to stop this ongoing transmission.
Thanks, Dr. Bell. Lauren?
Hi, Dr. Bell, Lauren Miller, WSPA. I wanted to ask, it's kind of touching on the decrease or increase of cases, but I mean, obviously we're all here because these cases continue to climb. Is there a worry that the decrease in cases is really nowhere in sight, considering if you had said and you had touched on, it's unclear where these new cases are linked because it's so widespread?
The majority of cases that we have identified in the upstate area are associated with known links of transmission, either exposures in school settings and healthcare settings, and primarily in households and other public settings where we have identified cases. It is the most recent case identified in the PD region that we haven't been able to establish an epidemiologic link, a history of exposure to any cases or any areas of transmission in the upstate. So that is a cause for concern, that there can be unrecognized community transmission in other areas. And again, it is just too early to tell if spread will continue into other areas, if spread will continue in any area where there's the lower than that hoped for vaccination coverage that I just mentioned. And so where we are in this transmission of cases at this time remains unknown.
Thank you. And Julie?
Yes, thank you. Julie Steenhuisen with Reuters. A couple of questions about the vaccination increase. what did you see for vaccinations in the upstate in January compared to with a year ago? And then can you characterize who was getting vaccinated in January in particular? Are these people who were getting second doses or catching up, or are these initial doses in people who had previously injected vaccines?
Okay, so several questions there. I think your first question is asking, what did we actually see in the upstate in general for uptake?
Yeah,
Is that your
I mean,
first
you
question?
offered the state, you offered state and Spartanburg. I'm just wondering what did you see in upstate in that, broader region, just in terms of numbers, if you have those.
We can provide that number
Okay.
After we get off here. Don't have
Okay,
that
and
right
then
in
just
front of me.
can you characterize like who was getting those vaccines? Like, where did you see the increases?
And we do have some of that information by age group, which we can also report to you later.
Okay, I'm more interested in, were these people who had previously received like one vaccine versus, and parents were like catching up their kids or getting an extra vaccine, like if your child is, it has one shot at the 1 year and they're due for the 4 year, are they getting it early versus are these people who have decided that they really want to get their kids vaccinated because the outbreak and previously had a different behavior on this? Yes.
Well, with the aggregated data that we have of hundreds of doses, we're not able to comment on what the vaccination status for each person who got vaccinated, whether that was the first dose, a second dose, or whether it was somebody who may have been previously vaccinated but didn't have documentation of their vaccination status. So with our aggregated numbers, with these hundreds of doses that we're pleased to report about, I'm not able to comment on what is the actual status of those numbers of people who did receive their vaccines.
Okay, thank you.
Thanks, Dr. Bell. And Julie, I'll follow up with you after the call on some of those numbers. And Joseph?
Hi, thank you for taking another question. A follow-up on the 95% vaccine coverage. Is that specifically just in Spartanburg County, the larger upstate region, South Carolina as a whole?
Well, that is our goal, to achieve herd immunity for the population as a whole. I mean, it is that level of vaccination coverage that helped this country achieve measles elimination. So that is a goal overall here in South Carolina, and that is a goal nationally, that we can maintain that high vaccination coverage that we saw 20 years ago that allowed us to eliminate ongoing transmission of measles. So that is not just for Spartanburg County or the upstate. We hope to achieve that goal statewide and nationwide.
Thank you. Tanner? And Tanner, you may be muted.
Sorry about that. I wanted to know the age range of the new cases that were reported on Tuesday.
We do not report on the demographics of individual cases. So I understand you're asking about the age range.
Yes.
I do not have that information available, but I'm sure we can make that available for the age range of the total number of cases reported.
Okay. Does the DPH track cases of medical complications related to the measles?
We do not have access to that being systematically reported to us. We work with healthcare facilities to attempt to learn about the complications that may be a consequence of measles infections.
And those adults who should possibly consider a measles booster for adults?
Booster doses are not recommended. This speaks to the very high effectiveness of the measles vaccine. If 2 doses are given in childhood on the recommended schedule, 97% of those people will be protected for life. There are some people who may have a weakened immune system or have something that impairs their ability to mount the strongest response. But nonetheless, this is not one of the vaccines for which booster doses are recommended. And so we want to make that clear that this is why this is one of the best vaccines for protection available, is because that lifelong immunity is achieved without booster doses. And so we just want to reinforce that message of the high effectiveness of this particular vaccine.
Thanks, Dr. Bell. And just as a reminder, we'd like to take one question at a time just so other folks can get a chance to have their question answered. Next is Lauren.
Hi, Dr. Bell. Thanks again for taking another question. I promise this is the last one from me. I just wanted to ask, with the upstate growing incredibly quickly, I think you did kind of answer this, but I just wanted to ask just in case, are we able to discuss if these cases are mostly people who have moved to the upstate or really South Carolina, or have we seen them more so the people who have grown up here or locals, so to speak?
In our investigation of cases, we don't collect information about duration of residency in that area, and so that's not information that we have about the cases.
Okay, thanks so much. Sorry.
Thanks. Allison?
Hi, Allison Young from HealthBeat. Thanks for doing this. During your opening statement, you said that several pregnant women who had been exposed to measles required treatment with immune globulin. Can you share anything more about even just in general, about the circumstances of those exposures and also whether they occurred in healthcare settings?
No, I can't provide any more information about those cases.
Thanks. And Diamond?
Hi, can you hear me? Is my mic working?
Yes.
Okay. Diamond is from WPDE News 15. I was just wondering, with the 3 new cases that were just reported in the PD region, is this gonna provide like a greater threat to the PD region? Like how deep in the region were the cases, and does this just provide a greater concern?
It gives us concern because because the case itself, to our investigation so far, we've not been able to identify a source. So we're uncertain of whether or not there is transmission in a new area, or if this case was actually had visited an area where their known cases are occurring. We have looked into the vaccination coverage in this region as compared to, say, the upstate. And so it is a little bit reassuring that vaccination coverage in the schools in the PD area and in the population in general are a bit higher than they were in a number of schools in the Spartanburg area and in the upstate in general. And so, again, anytime we're in a population of people that have a higher level of protection, there's a lower chance of ongoing transmission. But I want to reiterate that regardless of where you live, if you are unprotected, we continue to encourage people that there can be unrecognized exposures, as we have announced in public settings in the PD area, that that just emphasizes the importance of getting that protection so that people are not at risk of being infected by unrecognized exposures, regardless of where they live.
Thanks, Dr. Bell. Tom?
Thanks for taking another question. I guess you'd have to speak about this generally, but in regards to the pregnant women who received the IgG treatment, could you explain why that's necessary and what the risks are to those women and to their babies from a measles infection?
Yes, administration of immune globulin gives people what we call passive immunity. In other words, we provide the protective antibodies through this immune globulin, as opposed to the body being able to mount its own active immune response. The reason this is necessary is because the measles vaccine is not recommended for pregnant women. and pregnant women are at increased risk of suffering or at a higher risk of suffering complications during pregnancy. Things like preterm labor, other complications with, anything that can affect another organ system. And there's also the risk of transmission to an unborn baby, or with the mother being infected very late in pregnancy prior to delivery and then infecting the infant. So it's very important to offer this passive immunity to pregnant women to protect them against the high risk of complications during pregnancy and to protect their newborn babies.
Thank you.
Thanks, Dr. Bell. Julie?
Yes, thank you. I'm just curious, how are you investigating the cases in the PD area? Are you using whole genome sequencing or something to try to establish whether or not they're related? And are you working with the CDC on that?
The way that we're investigating the case in the PD region is the same as we do for all other cases reported to us, is that we interview the cases to find out what their symptoms were when those symptoms began. That helps us identify and define the infectious period. And then we ask about their activities during the infectious period to help us identify contacts. We look at the sources of infections through these epidemiologic investigations. The genotyping is testing that is performed on measles isolates that are submitted to a lab, and it takes weeks for those results to be returned. The results of genotyping really does not help us much with identifying the source of infections unless there is a significant change in the genotype, which we have not seen from what's circulating in the country at this time. So genotyping doesn't help us with these epidemiologic investigations in real time in helping us identify the source. And our focus is really on interrupting transmission around known cases.
Thank you, Dr. Bell. And we've got one question in the chat from Judy Gatson at WIS. She says, concerns have been reported about inactive measles vaccines being administered between 1963 and 1967. What is the recommendation for those people to ensure maximum protection against measles?
Yes, for people who received a vaccine during that short period of time, that is a vaccine that did not confer as strong immunity as the vaccine that's widely used now. So for people who were vaccinated during that period, we do recommend that you consult with a healthcare provider and find out if you should receive another dose of the currently available measles vaccine.
Thank you, Dr. Bell. And as I said, we have to wrap up at 1:30. It looks like there aren't any more questions. So we appreciate everyone for joining us today. And thank you, Dr. Bell, for your time. If you have any follow-up questions after this call, you're welcome to reach out to our media relations mailbox. That is media@dph.sc.gov, and we'll follow up with you as quickly as we can. Thanks again for joining, and have a great day.
Thank you, everyone.